good evening and welcome to our webinar tonight. My name is Dan Krause, and I'm an insurance specialist at AMA Insurance. On behalf of AMA Insurance and our carrier partner, Transamerica Life Insurance Company, the underwriter of our AMA-sponsored Medicare supplement insurance plans, we want to welcome and thank you for joining us for the webinar tonight, Making the Most of Medicare, Understanding Your Options. Our presenter tonight is Michael Sosnowski, Director, Advanced Markets at Transamerica. Mike joined Transamerica in 2008 and joined the Advanced Markets Group in 2012 with more than 20 years of experience in the financial services industry. His professional experience allows him to travel the country presenting advanced financial planning strategies involving Social Security, Medicare, estates and trusts, qualified plans, and IRAs. He's a certified continuing education instructor, and Mike also contributes to the ongoing development of Transamerica's internal financial planning classroom and curriculum. As I mentioned, my name is Dan Krause. I'm a physician insurance specialist at AMA Insurance, and I've been working in the insurance industry for 18 years myself. I consult with physicians and physician families at all life stages, offering professional guidance and insurance solutions to help protect financial futures. Bring firsthand knowledge of disability, life, and Medicare supplement insurance. Before we get started, just a couple of things I want to tell you so we can get the most out of tonight's webinar. First of all, there will be Q&A session at the end of the presentation. There is a question chat box on the screen. Go ahead and type your questions in there, and we will read those at the end. And in case you miss any of the webinar, need to leave early, we will email a link to rewatch the webinar, so you'll be able to review it later if you missed some of the webinar. Okay, I think we're all set. So Mike, you can take it away.
All right, sounds great. Well, thank you, Dan, and I want to thank everyone for joining us for tonight's presentation on Medicare. And really our goal is to provide you with some information on those different parts of Medicare. And really, hopefully, we can clear up any confusion about the program. Because if you find Medicare confusing, you are not alone. A recent survey from eHealth found that 75% of beneficiaries think that choosing a plan is incredibly confusing. And most of this confusion is from having to navigate the multiple parts of the program, choosing between original Medicare and Advantage, whichever is better, trying to figure out the different enrollment dates. So those are a couple of the topics we're going to cover today. And again, we want to provide this high-level overview, really, of those options that you'll have when the time comes to enroll. But I think that's really what's nice about Medicare is that you do have options. In fact, starting at age 65, we might have more health insurance options than we ever had in our working career. So we really need to understand those options, and that way we can really figure out what coverage is out there, and that way we can figure out the right coverage for our needs. So today we'll look at those 4 parts of Medicare, different costs associated with those parts. We'll talk about the differences between original Medicare and those Advantage plans that are out there. And then we'll look at some of those different enrollment dates. So let's start here, really just a high-level overview of those different parts, some of the different Medicare terminology that we're going to come across, like these terms right here. So before we go into too many details, here's really 3 terms that are going to come up really all the time when it comes to Medicare and really Medicare costs. So I'm sure we're all familiar with these 3 insurance terms on the screen. Deductible, right? Just like a homeowner's policy or your car insurance policy. Medicare works really the same way in the sense that you pay out of pocket up to that deductible limit, and then the insurer, Medicare, pays expenses going forward. And then once you met that deductible, then we would have a copay or co-insurance requirement. So that kicks in, and really what that means is that you basically share costs with Medicare, right? You pay a certain percentage of your bill. And then the last term, premium, that's the amount that the insurer is going to charge you, that Medicare charges you to provide coverage. So pretty standard insurance terms, but every part of Medicare, whether it's A or B or D or Advantage, they all have a deductible, a co-insurance, and possibly a premium. Something else that's pretty standard with Medicare is that it's an individual benefit. And what I mean by that is that there's no family coverage when it comes to Medicare. Each spouse is covered individually, really at their own age, 65. So just because an older spouse turns 65, becomes eligible for Medicare, that doesn't mean that the younger, not yet age 65 spouse also becomes eligible for Medicare, right? You have to be 65. So if that younger, under age 65 spouse, if that spouse is not covered by health insurance from an employer or an spouse's employer, then what they may have to do is look out at the exchange for health care coverage options. And that's really true until they attain age 65. So 65, that's kind of the magic age, right? That's the eligibility age for Medicare. And when you're eligible to enroll, that's when you're really going to have these two options. So this screen here, we have really the first option on the top, and that's choosing the coverage managed by the government, Original Medicare, where Original Medicare is going to be made up of Parts A and Part B. And then if you need prescription drugs, then you'll have to enroll in Part D. And then, depending on what costs look like, you may want to choose a Medigap policy. And the costs, when we think about Original Medicare, they could be somewhat unpredictable. And that's where a Medigap policy can really come in and help streamline some of those costs associated with Original Medicare. Because what these policies do, these Medigap policies, is they cover some of the premiums or copays or coinsurance, deductibles. They really cover those out-of-pocket expenses that come along with Original Medicare. Or you could have the other option, and on the bottom you can choose a Medicare Advantage plan, otherwise known as Part C. And what these are more comprehensive plans that are provided by private insurers, where they may include different coverages like prescription drug coverage, and they may also include other services that Original Medicare doesn't cover. So more comprehensive umbrella type plans. So what we have on this slide here is just an overview of those parts we just talked about. And what we have is really what they cover. So as I mentioned, Original Medicare, Parts A and Part B, where Medicare Part A, that basically helps pay for hospital stays. Hospital stays and stays in a skilled nursing facility. Medicare Part B, well, what that helps pay for is preventative care services like your doctor visits. Now, Parts A and Part B, Original Medicare, does not cover prescription drug. So if someone enrolls in Original Medicare and they take prescription drugs, they're going to need to enroll in a Part D plan. So Original Medicare, A, B, probably D. And then with that too, you may decide to enroll in Medigap. And that's really Original Medicare right there. And then we have option 2, which is Part C Advantage. And these are more comprehensive plans, as I mentioned before, where they're going to cover really similar services that Original Medicare covers, but there's a good chance that these plans will also cover additional services. So what we'll do is we'll look at those in more detail. So here is Part A. Now, when it comes to costs, most will not have a premium for Part A coverage because it's Part A that you've really been paying for through your employment. It's really through your payroll taxes that you've been funding Part A as you were working. So Part A, basically, if you or your spouse has 10 years of work history for the most part, or what Medicare considers 40 quarters of coverage, then you're not going to have a premium for Part A. So that's where the Part A no premium comes in, right? So 10 years of work history, you're probably good to go. But if you or you and your spouse If you have less of a work history, then there will be a premium. And the premium can range anywhere from $311 per month all the way up to $565. So that's, again, just a handful of individuals that usually have a premium. I think last stat I saw, I think it's 96% of beneficiaries do not have a premium with Part A. So this is what it covers. Part A will cover those hospital stays. It also covers skilled nursing services. It covers hospice care, inpatient rehabilitation, and then it also covers some home health care services. Now, Part A may not have a premium, but it has this deductible, right? This deductible on the left as well as co-insurance. So the deductible before Part A kicks in is $1,736. So that means you have to pay that total amount out of pocket before Medicare Part A covers anything. So that's the deductible. But the thing with the deductible is that it's a little bit different. It's a little bit different than what we're probably used to. And what I mean by that is that when we talk about deductibles, usually a deductible is going to start at the beginning of a year and then end at the end of that calendar year. With Part A, it's a little bit different because Part A's deductible, it's based off of something called a benefit period. So if you ever hear benefit period with Medicare, this is what they're talking about. And basically, it's a benefit period, and it starts when you're admitted to a hospital and then ends after you've been out of that hospital or a skilled nursing facility for 60 days. But while you're in that hospital or the facility, depending on how long you stay, you may have a co-insurance requirement. And you can see by this slide, the co-insurance really depends on that length of stay. But the deductible, what's significant about that is that if you're in your benefit period and you have to be readmitted to, let's say, a hospital, you don't have a new deductible. But if you're outside the benefit period and you have to go back to the hospital, deductible starts over. So that's where that whole benefit period could be important. So that's Part A, hospital insurance. We have Part B, which really helps us pay for that preventative care type stuff, that outpatient hospital care, where it's going to cover things like doctor visits, x-rays, labs, some medical equipment. And when we look at B, Medicare usually covers 80% of costs. So that means you typically owe about 20% of whatever the cost is. So it's an 80-20 copay. And with that too, B does have the deductible. And for this year, it's that blue $283. So you pay $283 out of pocket, and then B covers 80% of your expenses going forward. However, that's not the only cost with Part B because we also have a monthly premium. So Part B has a premium, and this premium that you're going to pay really depends on your modified adjusted gross income. So for most individuals, you're going to pay a base premium. And that's that first column on the right over there, base premium $202.90. But these premiums with Part B, they're means tested, which means they're based off of that modified adjusted gross income you have coming in. So what that means is that the higher income you have, right, higher income you have in retirement, the more that Part B premium is going to cost. Like for example, if you file a joint return and kind of towards the middle here, if your income was $274,001, your Part B premium is going to be $405.80. But the tricky part is that it's not your income from this year, right? The premiums for this year are based off that income that you reported on your income tax return from 2 years prior. So as you can see from the slide, the higher your modified adjusted gross income from 2 years ago, the more your Part B premium could cost. And that column on the far right over there, that's referred to as income related monthly adjustment amount, or IRMAs. So if you hear the term IRMA with Medicare, just know that that refers to that extra premium that you're going to pay in Part B if you have higher income. So here it's really important to think about, just maybe different strategies to control your modified adjusted gross income in retirement, so that way you can avoid those IRMAs and really keep those premiums down. But if you do have a high income year and you're subject to this higher premium because you've been hit with an IRMA, well, you may be able to appeal. And that's what we have on the screen here. So if your income was higher because of a life-changing event, like something that temporarily increased your income, then what you can do is reach out and request a new initial determination. Or maybe your income's just lower now than it was 2 years ago because of some sort of event, right? Um, maybe you had one of these 8 life-changing events on the left-hand side over here, like maybe a work stoppage because of retirement. You can request a new initial determination, and maybe they just might waive that IRMA. So that way you would just pay the base premium. So what we have on this slide is just a couple of strategies that individuals will often use to maybe control that retirement income, maybe avoid some of those IRMAs along the way. What some individuals will do is maybe postpone distributions from their retirement accounts, right? Distributions, taxes, income. Some individuals may look to maybe those losing stock positions, right? And they could utilize what's referred to as tax loss harvesting, maybe to reduce some capital gains along the way. Some individuals, they make qualified charitable distributions. That lowers your income for the year. Others may decide to defer Social Security for a couple years, just until maybe their other income sources go down. The thing here, though, is like with this slide or really anything, is that some of these ideas may work for some, but not for everybody, right? Because everybody's situation is completely different. So anyway, speaking of IRMAs, which we've done a lot so far, IRMA speaking, but those Part D premiums, prescription drug, they're also subject to IRMAs. So Part D, prescription drug coverage, if someone enrolls in original Medicare and they take those prescription drugs, then they're going to need to enroll in a Part D plan. And when we look at Part D, a lot of different plans out there. And these plans cover a lot of different medications. And if we were going to look at the costs of these different plans, well, they're going to vary. They're going to vary depending on the drugs that you need, the different plan that you choose, also dependent upon the pharmacy, whether or not the pharmacy is in the plan's network. So a lot of different plans to choose from, a lot of different options with all these plans. But one thing that's consistent, on a side note, is that when we look at Medicare plans, they now all have a $2,100 out-of-pocket maximum. So $2,100 out-of-pocket maximum for this year, which is still a lot, but definitely helps out. So here are those Part D premiums. And again, Part D premiums based off of, one, the plan that you select, but then there could be this IRMA, the adjustment, based off of your modified adjusted gross income. So just like Part B. So the higher the income you have, the more your Part D premium could potentially go up because of those IRMAs here on the right, that right column. So if you file a joint return and you had an income that was above, again, that 274,000. So income above 274 in 2024, right? Because we go 2 years back to look at income. So joint return, income 274 or greater, you would pay the cost of whatever your Part D premium plan is, whatever that premium is, plus an additional $37.50 a month. That's the IRMA. So that was Part D. Part D is prescription drug. And then we have Medigap. So as I mentioned before, Medigap policies basically help individuals pay for some of those original Medicare expenses. So these plans, these policies, only available for those that choose to go down that path of original Medicare. And basically, what these are plans for a premium that will cover some of those co-pays, some of the co-insurance, even some of the deductibles that are out-of-pocket expenses with A and B. So really what these plans do is these plans help to make costs a little bit more predictable. And right now it's about 40% of all original Medicare beneficiaries or original Medicare enrollees. What they'll do is they'll choose one of these supplement plans. So about 40% go into Medigap. As I mentioned before, Medigap does have a premium, and the premium itself can really vary because these plans are offered by private insurers, and so it's really these different insurance companies that can really charge different amounts, and they can base their premiums off of the area of the country you live in, if underwriting is involved. So if we looked at the costs of really the most popular plan that's out there right now, that's a plan G, premiums on average about $100 a month. I mentioned G because it's the most popular, but right now there are 8 standard Medigap plans. And you can see by this slide that they cover different things from Part B coinsurance to Part A coinsurance, possibly Part A deductible or Part B deductible. But what this chart shows here is 10 plans, only because F and C are no longer available to new Medicare beneficiaries. So we have 8 standard plans going forward for new beneficiaries. And as you can see here, towards the middle, Plan G, it's really the most robust plan out there. So it covers those different co-insurances, those different co-pays, deductibles, also covers foreign travel emergencies. So that's definitely the most popular plans out there right now. So that's original Medicare, right? We have A, hospital stays, B, preventative care, D, prescription drug, and then maybe Medigap. So 4 different insurance cards for the individual. Here we have option 2, which is really one insurance card for the person, one insurance card for you. And this is Advantage, otherwise known as Part C. And Part C has really been growing in popularity. But when we look at Part C, the average beneficiary has access to over 50 different Advantage plans out there. So that's the thing with Advantage. There's so many different plans out there with so many different coverages that you really have to shop around just to see what's the best fit for your needs. And really, since these plans are really comprehensive plans, what they'll do is they'll cover those services that original Medicare covers, but may also cover additional services. Some Part C plans, they'll cover that prescription drug. So that could be covered. And some plans will even cover dental. Some will cover vision. Others will cover hearing. Those 3 services, they're not covered by original Medicare. So here we have really one plan and everything's covered under the one umbrella. That's Part C. So let's take a look at some of these costs, right? Some of the costs of these plans. But before we do, we have to look at the cost of healthcare and retirement, only because year after year, healthcare costs, top concern for most individuals that are heading into retirement, right? Those pre-retirees or even those retirees. And really, I mean, if you look at the stats on the slide, as you can see by that middle stat there, a healthy couple, age 65, will spend on average $395,000 in retirement healthcare expenses. That's outrageous. So kind of makes sense that on the left, 45% of individuals ages 55 to 64 concerned that they're going to have significant medical expenses as they get older. And remember that Medicare doesn't cover everything. One of the most expensive services in retirement that Medicare doesn't cover, long-term care. And unfortunately, 70% of us are going to need some form of long-term care, and Medicare only covers those stays that are medically necessary. So Medicare does not cover custodial long-term care. So costs, right? All this talk about healthcare costs. How much does Medicare cost? Well, with original Medicare, we want to know the total premium for really the three parts, right? The three parts as well as Medigap. Now, if we look at the total premiums for original Medicare, as I mentioned earlier, most aren't going to have a premium for Part A. Now, Part B, base premium, $202.90. When we look at prescription drug coverage, the average plan out there will cost about $34.50 a month. So again, the costs vary greatly because of different prescription drugs that are included, the number of drugs that are included, but on average, $34.50. And then Medigap, well, we already said about $100. So if we get an average monthly premium for original Medicare, it's about $337.40 per month. That's original Medicare. Now, before we look at Advantage, a question that comes up a lot, specifically with costs, and it's really a question that's specific to individuals that are age 65 or older and are still working, right? They decided to continue to work, they're still working. Question that comes up is it better to sign up for Medicare or is it better to stay on my employer coverage? Well, it really depends, right? Because for some, it may make sense just to drop that employer coverage and enroll in Medicare. Now, for others, it may make more economic sense just to stay with that employer plan. And really, that's the reason why it's so important to do that cost analysis, right? Look at the different costs associated with employer premiums, Medicare premiums, especially if you do come across a situation. We're talking to some individuals where they were covered by an employer plan, and then one spouse decided to retire at 65, and they were going to just stay with the younger spouse's health insurance with that employer plan, right? Just pay those premiums, and they didn't really even think about shopping around for Medicare. They decided to look, and they found an Advantage plan that was the exact same coverage as the employer plan, but with that younger spouse switching to individual coverage from family coverage, they were able to save about $300 per month. So again, it all depends on your circumstances, your situation, but it's always a good idea to at least see what the costs are of the different plans in your area. So speaking of costs, let's look at Part C costs. Now, as you can imagine, Advantage premiums, they really vary, right? They vary by the plan type and the services the plan provides. If we were looking at that average monthly premium for Advantage, it's about $14 per month. But this premium, $14 a month, it can range anywhere from nothing, right, a zero premium plan, all the way up to north of $200 per month. And really the rule of thumb here is that a lower premium plan typically means higher out-of-pocket expenses or higher deductibles, just higher expenses on the back end. But also, the reason why these plans really have such a significant range in these monthly premiums is because there's so many different plans out there with different coverages. So again, lower premium usually means you're going to have maybe higher deductibles, right? Higher out-of-pocket costs, whereas those higher premium plans, they usually have lower expenses on the back end. So that's Advantage. Something else to remember with Advantage, though, is that these plans require PPOs or HMOs. So your provider has to be in network, because any out-of-network provider means you're going to have higher out-of-pocket expenses. So if we total really everything up for Advantage, you still have to pay for Part A. So you still have to pay Part A premiums. And again, most will not have a premium, but you'd have to include Part A premiums, and then you still have to include Part B premiums. So you would still have the $202.90 a month. And then you're going to have that Advantage premium, where, again, the average about $14. So if we total those together, basically we get an average monthly premium of about $216.90. So $216.90 for Part B. Now, if we're going to compare that with original Medicare, then really original Medicare costs about $120 more per month, right? $337.40 for original Medicare. Compare that to the $216.90 for Advantage. So those are averages, because again, it really depends on the Advantage plan you purchase. It depends on whether or not you go down original Medicare and decide to purchase a Medigap plan, right? So there's a lot of variations that could go into that. So this is just a generic, high level average, $216.90 compared to $337.40. So now that we looked at the costs, what we could do is look at a couple differences between original and Part C. So the question that always comes up here is, well, which is better? What do you think I should take? Well, it really depends your personal situation, right? Your unique circumstances that you have. And basically what you want to do is, I mean, kind of makes sense, but you just want to make sure you're not paying for services you're not going to use. And you are paying for everything that you do need, right? You want to make sure that nothing's left out. But it's easier said than done, right? Because there's so many plans out there. And what you really need to do is kind of think about what you're looking for, right? So if you think about your personal health situation, basically what that's going to do is really dictate what services you'll need going forward. You know, is an Advantage plan going to cover all those services I need, or am I going to be required to go out of network and pay more out of pocket? So that's something to consider. Something else is, you know, if you waited to enroll in Medigap, you might have an underwriting requirement. And that's what we have on the dark blue on the left here. Depending on your state, you can have an underwriting requirement that's going to increase your premiums going forward. Or on the right, there's special Part C plans out there, these special needs policies. So if you have a certain disease, like maybe diabetes, you might qualify for one of these special needs Advantage policies going forward, which will really cover those services that are specific to your condition. So again, it's your health that you want to take into consideration and look for the services that are available from there. Another consideration is really travel, right? Retirement travel. Here you can see 98% of US physicians will take original Medicare, but with Advantage, again, you're going to have to find that doctor that's in network. So if you're a snowbird wintering somewhere nice and warm, you got to find that in-network doctor for the area you're part-timing in if you went down Part C, right? If you went down the Advantage route. But on the other side, original Medicare, you could pretty much see anyone. So that's original Medicare. 98% of physicians will take original Medicare. But what about those individuals that want to travel overseas, right? When it comes to foreign travel, you want to make sure that the Advantage plan you select covers just that, right? Covers foreign travel emergencies. Or if you're an original Medicare doesn't cover those costs, but a Medigap policy might. So that's where you really got to think about what type of travel you want to do, your health condition. With that being said, though, there's a lot of tools out there. And there's a lot of different comparison charts like this one here. And this one's from Medicare Interactive. And what it does is, as you can see, it answers 7 of really the more common questions when trying to figure out that right coverage. Like, for example, on the top, can I stay with my current doctor, right? I've had this doctor forever. I want to stay with this doctor. Well, if you decide to enroll in original Medicare, most likely, right? Column in blue, you probably can. Because again, most doctors will accept original Medicare. So if you want to continue with your doctor, if you want more flexibility when you travel, you'll be able to use more benefits anywhere in the U.S. If you are down a little bit, if you are in a position where you need a referral, right? You need to see a specialist. Do I need a referral? Well, with original Medicare, no. Advantage, the answer is most likely. And then if we are talking about out-of-pocket maximums, well, Advantage in Brown, Advantage, there are out-of-pocket maximums, which is great, but with original Medicare, no out-of-pocket maximum. Or if we're thinking about just really budgeting and making our healthcare costs a little bit more predictable, original Medicare, you basically pay 20% of whatever that charge is for covered services. So it really could be 20% of almost anything. Whereas with Advantage, you usually just pay a fixed copayment at that time of service, really regardless of what the total cost is. So Advantage could be a little bit more predictable when you're budgeting for some of these expenses. But as you can see on this slide, and it's just one tool out of many that are out there, but what you can see is this slide could help with some of the common questions that come along with the whole decision process. Now, the other thing to remember, and I kind of alluded to this earlier, but original Medicare doesn't cover dental, vision, or hearing, as well as these other surgery or other services like cosmetic surgery, acupuncture. Only specific Advantage plans will cover some of these services. So what that means is that if you go with original Medicare, or if you do go with an Advantage plan that doesn't cover these services, vision, dental, hearing, then you may want to look at a standalone plan, right? Additional coverage through a standalone plan. Otherwise, these costs will just be additional out-of-pocket expenses in retirement. So what we'll do is we'll wrap up with a look at enrollment, because enrollment, you want to make sure you get this right, because if you are supposed to enroll and you don't, you'll be penalized. So we'll start with age 65. So age 65, important age, because that's really when you first become eligible for Medicare coverage. And that's really when you can first enroll in Medicare. So the initial enrollment begins 3 months before you turn age 65, and then extends 3 months after that month that you turn 65. So really, this whole initial enrollment it's a 7-month window, but you can't miss this enrollment, because if you're supposed to enroll and you miss this enrollment period, then that's when penalties will apply. That's when the penalties kick in. So make sure if you are eligible to enroll and you have to enroll, make sure you do enroll, because these penalties with Medicare, they last a lifetime. But this initial enrollment right here, age 65, applies to a lot of beneficiaries, but not everyone. And that's because if you're still working and you're 65 or older, you may have coverage from your employer, right? You may have credible coverage, which satisfies your health insurance requirement. So if you have coverage from your employer, you may not have to enroll in Medicare. So really the takeaway here is that if you are in that situation right, 65 and still covered by health insurance at work, check with the human resources department, right? Check with really the benefits specialist just to determine how your company's health insurance coverage integrates with Medicare. Is Medicare primary or is the employer plan primary? Really, what we want to try to figure out is what's the coordination of benefits between these two coverages. And it's usually smaller businesses, usually businesses with 20 or less employees. That's where Medicare may actually be primary, meaning that if Medicare is primary, the primary coverage, then you still need to enroll in Medicare even if you have that health insurance at work. So that's usually, again, for smaller companies, companies with more employees, usually there is no requirement to enroll in Medicare until you no longer have that coverage, right? Maybe you decide to retire, whatever it is, when that coverage ends, then you have to enroll in Medicare. So once you lose that health insurance, you have to enroll in Medicare, and what Medicare will give you is up to 8 months. So 8 months, beginning the month after you were covered by that group plan, you have 8 months to enroll in Parts A and Part B without any penalties. And this enrollment period is called the special enrollment period. So the first one, the 7 months, initial, this one, special enrollment period. So you have 8 months for A and B. And if you need prescription drugs, well, they don't give you 8 months. They give you 63 days. So you have 63 days to enroll in Part D for that prescription drug coverage. And here's just kind of an overview of that right there. So this is an overview of that special enrollment period. Part B, 8 months from losing that credible coverage. Part D, 63 days. So we have initial, we have special, and of course we can't forget about open enrollment. So open enrollment, that's from October 15th to December 7th, and it's really anyone who's in Medicare or who's Medicare eligible. What they could do is they can basically make changes to their existing coverage. So here's, during this time that you can maybe look at different Part D plans, maybe switch from one Part D plan to another, or maybe drop drug coverage if that's the right move, or um, you know, change that coverage to add more prescription drugs. Really, it's that time just to make sure that everything's current, right? That everything's current and that the prescription drugs you need are going to carry over to the prescription drug plan for the new year. So good time to look at Part D plans, make sure everything looks good. It's also a time when you can maybe switch. Maybe you're in original Medicare and think Advantage was probably the better route. So you could go from original Medicare to Advantage, or Advantage to original, or you could go from one Advantage plan to a new Advantage plan, something that has more services that you could utilize. So um, open enrollment is huge. So it's just like that employer sponsored coverage that we have. There's that open enrollment with Medicare where we want to make sure everything's covered going forward. Only thing though is that Medigap. So if you decide to change Medigap plans, for the most part, now this is in most states, not every state, but most states. So if you want to change a Medigap plan or add Medigap after you had that initial enrollment, after you enrolled in Part B, well, you might have an underwriting requirement. And again, underwriting could increase your premiums going forward. So that's something to keep in mind with Medigap. And then another common question we get involves HSA or health savings accounts. So once you enroll in Medicare, you can no longer contribute to your HSA. So make sure that you stop making contributions to an HSA before you enroll in Medicare, because Medicare basically disqualifies you from HSA contributions. So the big thing is that to be eligible to make an HSA contribution, you you can't have health insurance other than a high deductible plan, and Medicare doesn't qualify as that high deductible plan. And then one last thing here. So I quickly mentioned earlier, but another cost that you may need to account for in retirement. Um, hopefully you never have to, but it could be a potential expense, and that's long-term care. And remember, Medicare does not cover custodial long-term care. And I mentioned earlier, 70% of individuals turning 65 today will need some form of long-term care during their lifetime. And this care it can be pretty pricey. So just make sure you're aware of the potential and just make sure you have a plan in place just so that way these costs don't catch you by surprise if you need them. So that's really it right there. I appreciate everybody's time.